Good afternoon, folks. Today I want to go into more detail about how addiction fits into the pain-pleasure continuum. Those of you who have actually listened to some of the other clips will know that my late colleague and I began to examine addiction as an intermediary between pain and pleasure. And we were able to show that it was in fact on that continuum. And we then began to investigate why it should be. And we then discovered that people who are addicted to anything, whether it be a drug or a computer, use that particular addictive substance or thing in order to boost the pleasure-producing endorphin system. But there is a cost to that, because our bodies are designed to prevent one particular state overcoming another as a permanent state. In other words, if you could imagine in the wild, if people had 2-hour orgasms, it might be very pleasant, if not a bit exhausting. However, all the predators would then gang up and nobody would actually be able to procreate. And the reason for that is that our human sexual response is governed so that once we've had an orgasm, we return to normal fairly quickly so that we can then deal with our actual survival. And the same applies to addiction. When we're addicted to a substance, we are stimulating the pleasure system too much, and the body compensates by making that system less active. And for this reason, it's dangerous to take addictive substances or overdo any form of modality, including computers, because we overstimulate the pleasure system, and then we are left with an overactive pain system. And that's exactly what happens when people stop taking an addictive substance or drug. The pain system kicks in, and that is what causes the acute withdrawal state from either drug, alcohol, or one of the less obvious forms of addiction like gambling. That's fine.